Hey everyone, once again, this is Nadeem Sikander with this channel, and we're going to look at module number 1 into the Intro to Child Psychology. Again, my email address is there. I think what I missed is having a comment box in my YouTube channel. So what you can do is if I apologize if earlier you weren't able to comment on my previous module, which was more of intro to all of the modules that I discussed earlier in my last video. So this is going to be purely introduction to psychology, which is the intro part of child psychology. So we'll look into that. What we will be learning in this module is, these are the objectives. We will be looking at the definition of child psychology, theories of the psychologists, importance of recognizing abnormal behavior, and how physical issues seems like abnormal behavior. So let's look at the introduction part. So during childhood, there is a rapid development of the mind and body. Changes in a child's ability over time, including how their social, physical, cognitive, and emotional development occurs. Additional emphasis on how the development of a child psychological state is shaped through influences such as their environment and their culture. The role of a child psychologist and how they work with other medical professionals to improve the lives of children and their families. So that's basically, in a nutshell, the introduction to the child psychology during the childhood time. What is child psychology? Child psychology is a branch of psychology that focuses specifically on children and teens. Since the study of child psychology is so vast, an attempt to answer many questions, practitioners tend to focus on a specific area of the industry. These fall into either physical development, social emotional development, or cognitive development. When I say cognitive development, basically it means that it's an intellectual development. This is a very broad focus area, and we will cover how a person mentally and psychologically grows and develops from birth to adolescence. One of the biggest questions that child psychologists attempt to answer is the question of nature versus nurture. In fact, this is such a broad and big question that we will discuss a full module on this topic later in this course. Child psychologists try to make sense of every aspect of the child's brain development, including how child thinks, learns, interact, and respond to those around them. How a child understands emotions and how they make friends and how they develop personalities. Child psychologists will also measure the success or lack thereof of treatment by looking at the developmental milestones and that children have. This is important as these milestones reflect on the children's abilities, such as talking, and then these can be compared to the children of their age. So let's look at the theories of child psychologists. So there are many theories that child psychologists study, and many of these theories will be discussed throughout this course. One of the things to note is that just like many other science fields, child psychology is filled with many perspectives and multiple theories, which end up shaping how we view the development of the brain, both mentally and physically. So let's look at some of what is considered to be normal for a typical child. For the most part, children often have the same innate instincts, regardless of where they are raised. For example, a child quickly becomes attached to those who care for them, will begin to set up around 6 months of age, and often begins walking at the time when he or she is 1 year old. All of this considered to be normal developmental milestone, which is what child psychology is primarily based on. So no matter where the child is born, some of these instincts are, regardless of where they're born and where they're raised, are basically innate. Typical milestones. Parents tend to be on a lookout for typical milestones that all children must reach. For example, sitting, walking, and talking. If children do not meet these essential milestones or show signs of falling behind, the parents generally or must discuss this further with their pediatricians. Their doctors and others inform most parents regarding markers. So when you have children, your doctors and pediatricians will tell you about children's developmental markers, which children should meet, which identifies healthy growth, right? Similarly, parents are informed by family members, friends, and teachers when to seek, for example, medical professional opinions on a child's development. This is where a child psychologist might step in to help. Generally, the earlier a parent seek out assistance, the earlier is for the child to thrive. Some parent might find that their child is simply a bit slower at the developmental progression, something that is often not too worrisome to the expert. However, we want to keep that in mind. Other children may have more severe issues that call for extra attention. So you might be looking at something is sort of, it's not a big deal, right? You could think of it as just a bit of a delay in the child's growth or development. Nonetheless, it is important to keep in mind that if the child is not meeting the markers on a general trajectory, you must start to build that communication, because that may require an extra attention. So let's look at the difference between normal and abnormal. When development does not follow a normal, quote unquote, path as identified by the medical professionals, it is known as abnormal development. So when development is not followed by normal path, it is considered to be abnormal path by the medical professionals. Though it is referred to as abnormal, right? Though it is referred to as abnormal, in most cases, it is essential to remember that it might be due to things that are not in fact abnormal, right? So though we think the things are abnormal, right? But in most cases, it is important to remember that things might not be due to some things that in fact that are not actually abnormal. For instance, let me give you an example. Think of emotional disorders, learning difficulties, behavioral issues. Might all present challenges, but a child who has these impairment is not necessarily abnormal. Sometimes, for instance, these issues might develop due to environmental changes or divorce or death in the family or other traumatic events. And they might be causing emotional disorder, learning disability, or behavioral issues. So they're not necessarily can be considered, although they're presenting a challenge, but they cannot simply be put into an abnormal category. These events might cause misbehavior, mood changes, anxiety, but it does not mean that the development of the child is abnormal, right? As you learn more about how child's development and psychology work, it is best to avoid creating any black and white categories based on what is normal and what is not, right? So want to remember that it's not simply to put things in black and white, because that's to avoid creating that black and white category, because what you think is normal and what is not. Though it is natural for us, right? I don't want to miss that part. Though it is natural for us to create labels, so it can be dangerous to place a label too quickly as well. Though a label allows us to give a name or an identity to a misbehavior, every child is unique and beautiful and full of individual traits, experience, and abilities. Trust me, everyone, please. Every child is very, very special. You and I just do not know. No research, nothing can tell you how beautiful, how wonderful each child is. We just want to make sure that we don't put them in black and white categories and labeling them too early. Although I believe there is a lot work needs to happen when we, and of course there is work continue to develop, and things are happening where we are changing some of the names and identities that we used to put on children and about their learnings and their disabilities. So let's keep that in mind. Let's move on. So child psychology focuses what? How an individual develops both mentally and psychologically from birth to late adolescence. Since it is such a large area of study, most psychologists will specialize in different area of the field. So you will have, people specialize in abnormal psychology, educational psychology, cognitive psychology, so on and so forth. There are many fields because the area is so vast. There are psychologists in each area, specializing. So just keep that in mind, what child psychology focuses on. Recognizing potential issues. That's another important one. By understanding abnormal development, people who have children or work with children, such as parents, doctors, and teachers, should be able to recognize problems, potential problems. And this is important, as early detection equals early intervention. So you detect early, you intervene early. The sooner a child with a developmental issue receives intervention for the issue at hand, the better the future outcome will be. I cannot put more emphasis, my dear parents, on this, that you must sort of detect these. When a teacher tells you that, I'm noticing this in your child, please do not put it behind. Please don't do this. Start develop communication. I'm not saying you start immediately jumping on conclusions, but start developing these conversations early on. Talk to the teachers, talk to the principal, talk to the child psychologists in the building, or people that are involved daily in your children's life, for 180 days in the school or outside. When someone tells you something about your child, do not take it personally. Rather, take it that what can you do to understand what's happening in my child's life? Because like I said, the earlier detection is equal to earlier intervention. Issues with physical development. When people only focus on the developmental issues that relate to behavioral or psychological issues, they will often find that these physical problems will also affect development, right? So let me give you an example for that. In addition to a chronic illness, a child might be born with a birth defect, which can impact their ability to achieve milestones. Some of these might be present when the child is born. We may not even know, but those illnesses and there's a birth defect when the child is born. But others might only be noticed when the child matures. So as child grows a little bit older, you begin to notice that the earlier birth defect, right? So you wanted to make sure that we are working towards that, to understand that some of the physical developments are part of affecting the other areas. So caregivers like teachers and parents and whatnot should always be on alert. All of the teachers should really be on alert, especially I'm part of of a school system, so I'm a head of school, so I kind of focuses more towards with my teachers and ask them to always pay attention and be alert, and they do a wonderful job for issues that will make milestones such as child's walking, crawling, sleeping, eating. Are they slower to develop? Those caregivers, those parents, you wanted to make sure that you pay attention to that, because these are the issues with physical development. Learning and development. Now, learning is one of the major events in child's life, right? And through schooling, it is an obvious source of learning. It does not, however, always take place in an academic setting. It's not always that you're sitting down and somebody's instructing you and you think that's how the learning is taking place. Learning comes in all shapes and forms. For the first second of life, a child is undergoing a process of learning that never stops. This will have a dramatic impact on child's life and will affect how the child feels, thinks, and acts. We wanted to remember that. Learning and development begins the day the child is born, right? So we wanted to always keep that in mind. A quick reminder, generally, learning is one of the most important aspects of development of a child, which is why parents and teachers must know how to spot any issue. So that just to keep in mind. Learning disabilities are one part of it, but there are also several psychological disorders that appears in childhood that might be contributing factors. In some cases, it will be easy to spot these conditions, but in others, parents and teachers might dismiss it as something else entirely. Delayed speech, poor attention span, and late development of motor skills might appear as simply being a minor issue, but they could also be a sign of a major or a more serious psychological issue. So keep that in mind, that you wanted to consider learning is one of the most important aspects of development, which is why parents and teachers, we must pay attention and spot issues in the development. Why learning about child psychology? Well, we're heading towards the end of our presentation. Yes, studying child psychology can help you understand what is normal and what is not. But the key is to understand how to use this information in a way to help the child. So that's the key. You learn something, you run with it, you use it. You want to know what you have just learned. What will you do with that information to help a child? Because every child deserves a full attention, a life that every child deserves. You imagine just being a child, right? Wouldn't you want to have the life you actually deserve to have as a child? So we wanted to make sure we give them the best of the best, irrespective of where they are. Children are just deserve everything we can for them to turn them into wonderful citizens of a society. At the heart of studying a child, psychology is the need for a proper assessment, intervention, and ultimately treatment when problem arises. Doctors, teachers, psychologists, and counselors will know the best way to help a child who is facing a specific psychological challenge. Caregivers who have taken the time to learn about normal development and who are turned into abnormal behavior are the best to pick up on issues and seek out the help that their children need. So in most cases, the first step is to reach out to the pediatrician or family doctor, but in other cases, a school counselor, a psychologist might also help. It doesn't matter what the situation is. Communication is important, as I mentioned earlier, and it is the key to finding a diagnosis and creating an effective treatment plan. Parents should be able to share any relevant information with the medical professionals, with educators, with teachers. Counselors should be prompt when alerting a child's parents of issues that a child may be experiencing. So we need to be on alert when the children are facing and a child is facing a developmental delay in a school setting, in a daycare setting, and these can be spotted by many people in their life. Finally, in conclusion, you might be a parent who wants to get more information about your own child, or you might be a teacher who's seeking out a way to interact with your students. Alternatively, you might still be a student who are considering to continue your education in child psychology. or a career in child psychology, or you might be simply interested in this concept. The goal of this course is to give everyone a good overview of this field, and it will go in depth to explain the concepts, theories, and conditions and practice of those who work in the child psychology field. Again, lastly, end of the module number 1, we looked at the definitions, theories, importance of recognizing abnormal behavior, and how physical issues can seem like abnormal behavior. So thank you all very much for watching. Once again, this is the end of module number 1 with the intro. We will see you at the module number 2. Thanks all for watching. Have a wonderful night.